Good morning, Bruins. For those of you who have not had an opportunity to meet yet, my name is Julie Sina, and I have the joy of serving as your alumni director. So welcome. I'm coming to you from Westwood this morning, and we're gathering for the third time in our series, alumni who this time are living in Europe, to have a conversation about what their experience has been with COVID and anything else that we want to talk about this morning. So let's go ahead and get started, and we'll be together for about an hour. And one of the things I also want to share with you before we jump in and get started is thank you in advance for many of the questions that you've submitted. We also would encourage you to submit any follow-up questions or any other questions that you have in the chat room, and we'll do our very best to try to get to as many as we can within the hour that we're together this morning. And I'm so grateful to three alumni who've agreed to have a conversation with us this morning about what their experience has been, as well as wherever the conversation takes us. So I'd like to start by asking each of our alumni guests this morning to take a minute to introduce themselves, definitely share when you were at UCLA and what you studied while you were here, and then tell us a little bit about where you're living now and what you're doing now. So Francois, would you be willing to start?
Hey, Julie, with great pleasure. Hey, everyone. So my name is Francois Tristan. I live in Bordeaux, France, and I've been living here for the past 5 years. And before this, I was living in Paris for about 10 years. My story with UCLA is coming in 1999, 21 years back to North Campus, study at the Anderson School of Management, the MBA program. And I was for 2 years, and I stayed another 3 years in LA, starting some software businesses. And what I do right now professionally is quite different from this because it has turned to something different. Now I teach mindfulness to leaders in corporations. And interestingly, the crisis with the COVID has probably shed some more light on the need for people to get more attention and presence and care of themselves. Thank you for having me. That's great.
No, and thank you for sharing that, Francois. And one of the things we may come back to later is some of the sessions that we've been offering for alumni are in that mindfulness space, and they've been exceptionally popular. So that may be something we return to later on. Jade?
Yes, hi Julie, thank you so much, and thanks for everyone who's joining us this morning or afternoon, evening, depending on where you are around the world. So I was at UCLA in 2013-14. I did my master's of laws in entertainment, IP, and media. After graduation, I took the bar exam and ended up moving to Switzerland for a job at the International Olympic Committee. So initially it was supposed to be just 1 year in Lausanne, Switzerland by the lake, gorgeous place. Of course, I fell in love with the mountains, with the lake. I'm a huge skier. And I thought, you know what, the beach and LA can wait. I'm gonna stay in Switzerland a bit longer, and took another job in sports and media at Eurovision Sports. So what I do, I'm the lawyer, so acquiring and selling media rights. So I get to travel, well, I used to travel, I should say, a lot around Europe, and we'll talk about this a bit later, attending sports events and negotiating sports rights. And in the winter, I'm in the mountains somewhere skiing for sure. So been in Switzerland now going on 6 years, and it was supposed to be 1 year. So let's see what the future holds for me.
Thank you so much, Jade. Matt?
Yeah, hi, Julie. Thanks so much for having me. I'm coming to you from Brussels, where I've been living and working for the past year. Before that, I was living and working in Germany for about a decade, off and on. So I graduated from UCLA with my undergrad in 2000. I studied history and Russian, and like any young kid on the West Side, well, like many young kids on the West Side, started to, be a starving artist trying to get a foothold in Hollywood. A few things happened in world events the following year, so I left thinking I'd be gone for about a year or two, and 20 years later I look back on it and I'm actually a lieutenant colonel with U.S. Army Special Forces. I'm a Green Beret. So It's taken me a bit longer to get back to LA, and finally that's within sight here over the next 2 years. I'll retire from the job I'm at NATO right now, you know, and head back to Los Angeles. So I love Brussels, look forward to telling you about it. And I love working with the Alliance. You know, many people have said if you walk into a room and people look like you, think like you, and speak like you, then you're probably in the wrong place. So that's why I wanted to finish up my career here, and it's just an amazing place to be.
Well, thank you for sharing that, Matt. Let's stick with you for our first question. One of the places we'd like to start is if each of you would be willing to just talk a little bit about what the journey has been like for you in the country that you're living in now in terms of the pandemic, when things started and how it's evolved. So Matt, let's start with you in terms of tell us about the pandemic experience in Brussels.
Sure. So I deliberately chose last year when I moved here to live in Brussels because I wanted to live in the city because I've always been fascinated by it. And unfortunately, with my work still, I usually, in the absence of the past 2 months, I'm on the road a great deal. That, of course, all came to a standstill in April, and Belgium actually locked down pretty quickly. You know,
Did you lock down in April?
So no. The full lockdown, I don't believe, happened until the end of April. But I'd have to look at the dates. But I can remember very well being in Landstuhl in Germany, where I was there for medical appointments because old Green Berets occasionally have broken things that they have to have a look at. So
that's another webinar.
And I still remember thinking, because I was going to visit friends in Frankfurt, and it was, I want to say, third week in April. And just 48 hours earlier, Chancellor Merkel had announced that she wasn't going to close the borders. The Schengen zone will stay open. And then, you know, I said, no, I'll go to Frankfurt and visit friends. And I'm on the road to Frankfurt. I said, no, she is going to close the borders. That's exactly what that means. It's time to drive back to Brussels. And sure enough, 72 hours later, borders started closing within the Schengen area. You know, which was shocking to see in some ways. I mean, it was important. It obviously served its purpose, but obviously the intra-Schengen zone has a very important political status in terms of open borders and the meaning behind that. So that's been challenging to watch, being a believer in all the liberal principles that have set up the European Union and NATO and Atlantis and all things that underpin it. Here in Brussels in particular, I'll say that it's been a bit depressing because, like I said, usually I travel a great deal. Now I had the chance to be at home for 2 months, but everything was closed. So finally, as of 1 week ago, everything is pretty much open again in Brussels, cafes, bars, museums across the board. And, life is starting to start up again, because I can tell you, when the lockdown started for the past 2 months, as you probably heard, Brussels is a pretty dense city, packed, and a lot of traffic. And I commute usually an hour south to Supreme Headquarters Allied Powers Europe in Wallonia, coming from Brussels. And traffic is usually pretty bad in the mornings and in the afternoons. It was absolutely dead for 2 months.
Yeah, that's probably been the biggest change for Angelenos, as you may recall from your time in LA, is to see a vacant 405 is not an experience we're used to. So just to clarify, Matt, have you been sheltering in place during this time?
So yes, the Belgian government instructions, which NATO of course adhered to, were that working from home was at first mandatory and then recommended unless it was absolutely necessary. There were some situations where people from NATO, of course, needed to still go into base for one reason or another. And then, so that was worked out directly with the Belgian government to have the right paperwork in case we were stopped on the roads by police. There were checkpoints set up, and there were, the police were monitoring it, and the Belgian security services, and they were very professional to do it. So all those things we had to work out with them as the host nation.
Thank you. Thank you for sharing, and just passing on a few comments from alumni thanking you for your service. Thank you, Matt. So Jade, how about you? What's been your experience since COVID started, sort of launching into where we're at today?
Yeah, so it was quite interesting for me because I left for Thailand on February 28th. you know, not really knowing what was going on. It was kind of quiet in Switzerland until it really hit us. So the day I flew out, I had a layover on the 28th in Doha. And I remember getting an email from the office saying, there is a case at the office, so please, all who've been in contact with this person, self-isolate. Luckily, it was someone in a different building, but very quickly, my office has like 350 people in it. They closed down right away, even though Switzerland was all fully opened. The first case in Switzerland was something around, I think it was February 26th, that was detected. So it's very quickly came to my office, and they just told us, you have to stay at home. So I was traveling. I was like, what is going on? You know, everything was normal. We were planning business trips for March. There was really nothing in place. It just kind of hit us in the face. Mm-hmm. And my office has been really, really good at, you know, asking us to work from home, putting everything in place. So I came back thinking, okay, I'm just going to self-isolate for 2 weeks because I was just in Asia. And then I'll go back to the office. Like, they're going to reopen very quickly. And since I haven't been in the office since February 28th, basically. So the lockdown in Switzerland happened around the 15th of March. And again, I came back from Thailand on the 10th. And I went skiing. Like, the first weekend I got back, I went up to the mountains and everything was still open. So even though there were some cases in Geneva and Zurich, it was very kind of isolated in those two big cities. Mm-hmm. So yeah, ski resorts, some of them were still open. I went skiing not knowing that as of Monday I wouldn't be able to really leave my neighborhood. Mm-hmm. So yeah, it was very sudden. And then we tried to warn people around that, look, this is going to happen. I remember telling my family in Canada and friends in the US, telling them, look, this is going to hit you. Like, it's coming, because we didn't see it coming. But we share a border with Italy and France and Germany. So, of course, for us in Switzerland, it was kind of, at some point, we were in the top 10 countries hit by COVID in terms of cases. Considering we're a country of 8.5 million people, it's quite huge. And now we're ranked #1 country, the safest country for COVID. So in terms of government measures and all that, so it hit us very quickly, but the government was very good at reacting and putting everything in place. And now everything is reopened. Like, I went out to a restaurant last night, social distancing measures.
How long were you sheltering in place? It doesn't sound like it was as long for you as
No. So from March 15th until now, I still work from home. Until July 6th, I have to work from home. Then I'll go back 1 day a week.
Sounds like you're able to go out, though, as you said last night. You were.
Yeah, like, everything is reopened early June. And since the 6th of June, restaurants are reopened, everything is reopened, and it's quite weird, I'm not gonna lie. Mm-hmm. I think it's a bit quick, but there's an app for COVID tracing in place. Mm-hmm. So, you know, if everyone signs up, I think we've good chances of fighting this and not getting a second wave, hopefully. But except from the work from home, everything else is back to normal here.
Thank you. So moving to France, Francois, let's hear about your experience from the beginning of COVID, from your perspective to where you're at today.
Hey, I really want to honor the folks from California and from the US and from everywhere around the world. It's really nice to have so many people interested in hearing of what's going on in other places in the world. So thank you for having this, organizing this, and being here. It's being a roller coaster experience like everywhere else. There's been a full sheltering, full lockdown in France, starting at the same date that Jade mentioned for Switzerland. That was mid-March, and it was full sheltering of the whole country, and that was for 2 months until mid-May. It was announced that May 11th was the beginning of a progressive de-sheltering, which was really minimal at the beginning, and then there's been 2 phases since. And the next phase is actually next week, where there's going to be a full reopening of pretty much everything. Right now, the only thing that is not announced to be reopened is how do you call it? Dance clubs.
Mm.
So dance clubs are not supposed to reopen until September at least, which creates some frustration.
They'll still have to dance at home, I guess, huh?
Well, yeah, really, for the last month, especially youngs have really needed to have to throw parties. So around where I live, every Saturday evening, it becomes quite noisy because people need this. But as long as it stays limited to a private place,
Right.
even with a pretty significant group, it's okay. But public spaces are still limited in terms of capacity. There's no sports, no professional sports has started again. And the Tour de France has not been rescheduled. The French Open has been delayed until September, October. So yeah, but that's kind of how it went. I was very surprised with the discipline that the French people put into this, because we're probably not known for such level of discipline, but the lockdown was really strict, and people played the game.
Francois, how long was your lockdown period?
It was a full 2 months, mid-March to mid-May. And in terms of cases, COVID cases, it was really a big jump, probably up until the second half of April, and then it started plateauing, and now the death toll in France, total death toll is plateauing around a little less than 30,000 casualties. It's increasing.
One question that just came in is if any of you are seeing a surge, and Jade, it sounds like a no from Switzerland. Are you seeing a surge in France at this point in cases?
I'm sorry, are you asking me?
Yeah, I was asking, are you seeing a surge in France of cases, or have it leveled off?
Oh, no, it has strongly decreased for the past month and a half. I mean, maybe it's only like 100 or a couple hundred new diagnosed infections every day, which is not that much, and maybe just 10 or 15 deaths every day, which is, it used to be in the hundreds at some point. So there's a sense that the policies that have been followed have paid off, and people stay cautious around this, really wanting to avoid a second wave, because the economy has been very, very badly hit. Because it seems to appear that the tighter, the stronger the lockdown, the stricter the lockdown is, the bigger impact on the economy, and we've been hit really, really hard. Projections for the economy of France is around a 12% decrease in GDP for 2020, which is probably one of the highest decreases in the world.
Well, I did see, just so you know, Francois, on the Today Show today, while I was getting ready for work, one of their opening stories was the reopening of the Eiffel Tower. And
absolutely, yeah, that happened today.
Yeah. So we're going to move into some more questions that have come in, and sort of as a follow-up to what you each shared. One of our alums wants to know whether or not you think the government in your country is doing a good job of balancing public health during the pandemic with the push, Francois, you were just talking about, to open the economy again. So any thoughts or reflections on that? Anybody want to jump in?
And I'm happy to jump in from a sports perspective because I work in sports. So Francois mentioned a Tour de France, and I monitor that very closely because all the football leagues that started again, there's a huge amount of money involved in sports, and that can be lost in terms of media rights, sponsorship, and all that. So and also just the money involved is insane. So there's been so much pressure to start again. I mean, I know it's only a small part of the economy, and we might be talking again about small businesses, but so many small businesses are affected by sports stopping their broadcasts and their events. So that's, from my perspective, has been a huge push to start again. And also from a hospitality point of view, they've put so much pressure on the Tour de France to happen. All those small towns are relying on these revenues. And so it's been rescheduled for September, and a lot of events have been rescheduled. But I don't know if you read about the tennis tournament in Serbia. I think that the news went viral because it was just the first example of we need to still be careful. And it just shows that we need to balance. And we saw in Italy, it's been proven now that the patient zero was at a football event. So soccer, sorry, I'm becoming more and more European now, but soccer events, so that happened in the north of Italy around the end of February. So we just need to be extremely careful.
And Jade, probably as you're following very closely, and there's been a lot of conversation also about the opening of various, whether it's the NBA or Major League Baseball in the United States. So a lot of concern about that impact as well. So Matt, you were going to jump in and say something about that balance of public health and economy.
Sure, and just to open up with, I misspoke earlier. A correction: the lockdown actually did begin here on 18 March. I apologize. Third week in March, not in April. So when it comes to this tug of war between public health and economic interests, you're going to keep seeing this play out. And it's going to be fluid in every country. And one moment, one country is going to say one thing, and then condemn another country from saying another thing, and then the next week they may well say it too. It's an extremely frustrating time, I know, for normal people who don't work in government. And it was funny. I was actually on a webinar last night speaking on a similar topic, and I said, "Congratulations, welcome to my world." Governments often know far less than their citizens. We always like to joke that it's a convenient myth that the American government is omnipotent and omniscient when it couldn't be further from the truth. People on the inside always look at it like there's just a handful of people trying to keep the wheels on. So all that being said, you're going to continue to see this, and it's going to continue to be dynamic, and it's going to be frustrating at times. A good example here was about 2 or 3 weeks ago when the Belgian government announced that Belgian citizens and residents were allowed to take cross-border trips into Luxembourg, the Netherlands, Germany, and France, to visit family if they wanted. That was one of the stages of lifting the lockdown. Well, one of the problems was no one had told the French government. And so there were thousands of Belgians who streamed towards the border with France, only to be turned away by the French authorities saying, "Look, you need to tell Brussels to call us before they start sending people here to the border. We didn't agree to this. We're really sorry." I'd expect, I would just say that, it'll only continue. And, obviously with my day job and with people I have conversations with, the situation continues to develop, the more people can be patient with their governments because they're fallible, just like they are, and information is constantly being updated, whether it's, effectiveness of COVID-19 test kits, which have been notoriously ineffective to this point, inaccurate to, public health decisions. So I would just offer that it'll stay dynamic from what I'm hearing, at least until through next year, through the end of 2021.
And here's a question that's a follow-up to our conversation so far, and it comes from an alum in London who asks, he says that he finds it interesting that we're talking about a lockdown in Switzerland, Belgium, and France, and he said it doesn't feel like it's finished up in the UK. He says we feel in London that we're still in it. Any thoughts or comments about his observation from London?
Sure, Julie. So I've been meaning to get to London for a few weeks now, and yes, the UK has been slower to ease lockdown measures. I mean, it's just the timeline that the UK government has decided to go on. So, for example, from Belgium here, I could travel today anywhere to France, to Germany, to Denmark, pretty much anywhere within the Schengen area this week. But if I took the Eurostar to London, which is still running, then I would have to, and of course, decrease service numbers. But if I got on the Eurostar to St. Pancras, I would have to immediately self-quarantine for 14 days. So that restriction is still in place in the UK, even for foreign visitors.
So Francois, somebody would like to ask you a question. So let me pass this on. For those places where people are allowed to gather again, has there been an increase in COVID cases? And what has been the mask policy?
Yeah, thank you, Julie. I've been kind of typing like crazy for the past few minutes, trying to answer some questions in the Q&A. Yeah, so the mask policy is seen like by many as a big joke, because, but it seems like it's been the case in many countries around the world. Is like for the first 2 months of that crisis, authorities kept telling us that there's no need for masks because, you know, they don't protect you that much. But then all of a sudden, they started asking us to wear masks as the lockdown was ending. And it just happens that probably most of it was that we were just short of masks. And that seems to be the case in many, many countries, probably except some in Asia. And Germany seems to have been one of the probably best prepared countries in Europe too. So anyway, so some people kind of have mixed feelings about wearing the mask, saying, you know, we've not worn the mask before, why should we? But anyway, it seems people are complying pretty nicely. It's a mixed picture when you go in the streets. Older people wear the masks because they know they're probably more at risk. Younger people definitely don't wear the masks. Some parents wear the masks with their children, which sometimes is odd, but it's really probably to protect them. And it's only compulsory. I mean, it's mostly compulsory right now in public transportation. So if you take the tramway, the underground, the bus, you need the train, you need to have the mask. But if you go to restaurants, you don't have to. If you go to stores, you mostly don't have to. But store owners can have a policy where they ask you to wear a mask. So
are you finding in restaurants and in stores, is there a limit on how many people can enter, or the social distancing piece play into that?
It's becoming more flexible now. The past week or two, initially there was a pretty strict policy on people should stand 1 meter apart, like 3 feet apart from each other. And restaurants should remove, you know, half of the tables. But then, of course, it didn't work that much because restaurant owners wouldn't want to open the restaurants if it was to lose money every time they would open the restaurants. So as the numbers of COVID cases keep, you know, falling down, there's a less strict policy now, which means that people like servers are required to wear masks in restaurants, but customers don't have to. And they are required to stand apart 3 feet from each other, except if they are from the same family. So, you know, there's some flexibility in this, obviously. Okay. And people seem to act mostly reasonably around this.
We'll take mostly reasonably is probably a good description for most of our experiences right now. So another question that came in is, as you reflect on media coverage in your country, do you feel like it's been pretty accurate from your experience? Anybody want to, Jade?
Yeah, I'm happy to start on that because I was actually going to address that to bring back the point on London and in the UK in general. Matthew talked a bit about it. I think, you know, I have a lot of friends in the UK, and we've been talking a lot about why are they so behind compared to other countries, and why are they still in lockdown? Why is there quarantine now and not in the beginning? And that's been asked a lot, like why implement a 2-week quarantine for foreigners entering the UK or people who come from abroad now since the 6th of June when COVID started months ago. And I think they just have different vision on how to fight COVID. And in the UK, from what I heard and what I understood, the rules were always challenged. And even though the communication was really good with a lot of press conferences, daily press conferences, I think the reaction has been amazing from the government, really communicating well to the public what's going on. It kind of gave people a reason, or I guess tools to challenge what was being said from my perspective. Whereas in Switzerland, there hasn't really been that many press conferences, and when there was, they were in Italian, German, and French. So, I mean, I speak French, but German and Italian I don't. So it's not like they translate. You just do one part in French, one part in German, one part in Italian. So you don't get the full information unless you go in and search for it. And I don't really watch Swiss news. I'm just reading the news online, but people never challenge the rules. Swiss people are very resilient, I guess. They're told to do something and they do it right away. There's no questioning. It's the government said it, we're gonna do it, we're gonna get out of this. And I never really spent any time with my friends here, foreign friends and expats and local, questioning any of the measures in place. So that's quite different, I would say.
And a switch up on that question just a bit. Some of our alums would love to know how is the United States being portrayed in terms of the coverage of what's happening here? Anybody want to share your perspective or thoughts on that? Francois, you look like you have something to say.
I don't know. I mean, it's hard to say. It seems to me that a lot of the countries that were progressively hit have had the same pattern of thinking that it was not going to hit them, that it was for other people in other parts of the world. So it's probably the same that happened in the US, because it seems that, you know, public and media awareness on it came a little bit after Europe, which itself came quite significantly after Asia. And every country seems to have made the same mistake. I mean, most countries, most governments seems to have made the same mistake. Like if the borders would stop the virus, you know, everybody remembers in France that like 30 years ago, when there was the Chernobyl atomic cloud, that, you know, authorities were saying that it was not going to France because it would stop at the Rhine, or it would stop at the mountains or whatever. And, you know, same thing. So I don't know. I mean, there's been criticism from around here, around some of the policies that we've perceived the US was having or not having. But especially because there is a belief that the health system in the US is less accessible to a large portion of the population, because it's not so much public funded that it is, for example, in France. So that if the virus was going to hit, it was going to hit harder because of this. But I don't know. I mean, it seems it's a very mixed situation too. I've heard that California has taken strong measures very quickly, and other states too, whereas other states have done differently. So I don't know what to say else.
No, I appreciate that.
Jade and Matt, you need to take part of the hit here.
So what's the perception?
Matt, go ahead. I see you smile as well, so go ahead.
I told you guys I can't answer that question when I'm being recorded. Come on. I'll pass.
So another question that's come in from Coretta Harris, who's a member of our alumni board. So thank you for joining, Coretta. She is asking, with cases surging in many states in the United States, have you heard anything about a ban on US tourists in your country?
So I'm happy to take that one. The answer is no. Not at all, actually. We feel like, as much as I said Swiss people like to follow rules, there's also this idea that nothing will hurt us, like nothing will affect Switzerland. Like we're the neutral country, and we're in the middle of the mountains. We're surrounded by the Alps, and nothing will really hurt us. So based on this idea, I feel like they're just saying, yeah, no, now it's fine. We're the safest country. There's a tracing app in place. It's going to be probably, I mean, from what I heard, it's going to be mandatory for people coming into the country. And but in terms of banning people, not really, because also Switzerland is a big economic center, so we rely on foreign travelers. There's 2.1 million expats in Switzerland, a lot of Americans. I mean, it's a huge proportion of the population that are expats. So to say we're closing the borders to foreigners, to Americans in particular, I don't see this as being doable because of Zurich, Geneva being big centers, the UN being based here, WHO. I think it would be quite complex, but I'd be curious to hear, Matt, because you're in Brussels. Brussels is also quite international, to see if you heard anything on that.
Sure. I've been tracking, the latest news reports out of Brussels and the EU about potential travel restrictions coming into the EU from the United States. In the end, this is the decision of every sovereign government. So if Belgium decides that they don't want to allow this tourist season from the United States because they don't like the current level of COVID in the United States, then that's Belgium's decision.
So as a follow-up to that, Matt, a question just came in. John is wondering whether or not the EU is playing a major role, playing a major role in coordinating the response of member states, and I think as you just said, or individual states simply setting their own policies.
Right. There's a little bit of both there, and by all means, I'm no specialist in this field, but early on, I know that the EU received some criticism for their response to the pandemic, but since then have really made a lot of sweeping changes. And the Germans and the French and the Dutch have agreed with countries in Southern Europe, about how to deal with recovery. And the recovery package is offered to the economy. So in general, the trend is definitely upwards in terms of perception of the EU, I think, among Belgians or Germans, et cetera, or citizens of the EU, of how the EU is handling the crisis.
So I'm going to switch gears just a bit, and I've got two questions that have come in that are a bit more personal. And one is, how do you rely on, or how are you making decisions about what's best for you and your family, friends, in terms of venturing out? Anybody want to respond to that one? And the second part of that I said there were two questions. So, how are you making those decisions about how to venture out for you, your family, friends? And the second one is, how have you been taking care of yourself, engaging in self-care during a time where things have been restricted? So a bit more personal perspective.
Oh, go ahead, Francois. I see you're waving. Go ahead.
No, please, Jade. I can speak after.
Francois on stage. You jump in.
Yeah, so I was just going to answer the second part of the question because I think that's super interesting. It really opened up borders, like in terms of self-care and all that, in a sense that I've been able to join. I work out a lot, so I do spinning, HIIT, yoga, and this allowed me to connect with instructors in the US, on the East Coast and the West Coast, take classes with at gyms that I used to go to in LA, and to reconnect with those people and to attend classes of gyms that I go to when I travel to London for work. Or I think that's been amazing. And you attend those classes and you see on Zoom people based in Asia, depending on what time it is, but you see sometimes people connecting at like 5 a.m. in California just to attend a class that's, live in London at around like mid-afternoon. So it's been really interesting to open up borders. And so I've taken HIIT classes with instructors based in Australia, in LA, in New York, in Montreal, London, Switzerland. Like that's been, I think, incredible to just show us that we can still be happy and take care of ourselves while staying at home. That's been great, I think.
Francois?
Yeah, there are so many things that could be said on this, and thank you for the questions. Personally, this lockdown experience and the whole COVID crisis has been a wonderful experience in many ways. On a personal standpoint, and I know I'm in a privileged situation of living in a house with a small garden and my close relatives having stayed healthy. And I'm fully aware of people for whom it has taken a very big toll. But I also want to say this, that for some people, and many more than I would have thought pre-COVID, this has also been a time when people have been able to slow down, to reconnect with themselves, to take care of themselves. I'm not making a general statement. That's portion of the population, right? But when there's been polls around this in the general French population, and a good third of the people were saying, I've loved this. I've loved this because it has given me an opportunity to live something different, closer to my, to what's most important in my life, reconnect with what's important in my life. Again, recognizing that for many, many people, this has been so hard and people are out of their jobs, etc. But it also opens that door. And that's an interesting thing that I hope is not going to be forgotten too quickly.
And Francois, that leads into a question that just came in. So I want to follow up with this. I'm curious on your thoughts of this is, how has the mental health of the population been impacted by traumatic circumstances of COVID? So I know there's been a lot of conversation around mental health in the United States. So wondering if where that conversation is, or it's come up in the countries that are represented on the phone. So not been top of mind, Francois?
I'm happy to, but I've had a lot of hard times, so I want to be, aware of this too. Is that okay?
Your colleagues are acknowledging that this might be something you could speak to.
Yeah, I'm hearing that this is the big thing coming up.
Mm-hmm.
This is the big unsaid, unnamed. Is that at the same time that I was alluding to a portion of the people seeing opportunity in this crisis, then other portions of the people, and probably especially the young, in my opinion, especially the young part of the population, is probably going to face a long-term difficulty recovering from this, because job opportunities are not the same. Lots of students are graduating with minimal opportunities. They've not had opportunities to see each other, to have fiestas, to see their to have love affairs. I mean, simple things as this, and this is going to be really, really difficult. And I'm not hearing a lot from authorities, from governments around this, and that's one of the things I'm most afraid about is how to handle this and whether it's going to be properly handled.
Well, thank you for offering that perspective. And you mentioned this, and it's come up a couple of times in threads of our conversation, and that is the economy. So would appreciate hearing your perspective on what you're hearing about job prospects, for example, in your countries, and what recovery might be looking like. Does anybody want to jump into that?
Sure, I can jump in.
Thank you, Matt.
As I mentioned before, the EU has taken some pretty dramatic measures and to be able to help the economy in EU countries. And so businesses are starting to open up again, but they've already been releasing statistics of out of X number of bars and restaurants that were open prior to the pandemic, only this percentage will be reopening because this many have already folded because of the crisis and the economic impact. In any case, and this is, I go back to another point that I made that I mentioned I was in a similar webinar last night, is you're really going to see windows in this, as governments continue to, issue the best information that they have. And as the situation continues to change, everyone is, talking about how they want to avoid a second peak, et cetera. Odds are in countries we've seen that there will be more outbreaks. So there will be another spike here and there at different times, which potentially, depending on the government, will lead to another lockdown. So it's really going to be interesting the second time around to see which governments take similar measures. It's until such time that either a vaccine is found, or just like the influenza outbreaks of 1918 and 1957, which pretty much disappeared on their own. No human interaction there. Until one of those things happens, you're going to continue to have, spikes and potentially future lockdowns.
Mm-hmm. Any Jade or Francois want to comment on job market or what you're hearing there in terms of the economy?
Yeah, I think from my perspective, and I would just like to echo what Francois said, I'm aware how lucky I am to live in Switzerland, to have a job that's quite secure despite the pandemic, and to live in a country that has a really good scheme in place for people who might be furloughed or completely lose their jobs. So social security is very, very strong in Switzerland. So I'm aware of how lucky I am, and so that being said, I think we just don't know yet, because there's been such a good scheme in place to furlough your staff. So in my company, I'm still working 100%, but most of my colleagues are down to 80, some of them 50 or 20% even, and they still get 100% of their salary. So it's really amazing how much the government has invested, and that's the case for my company, but which is a major company in Switzerland, an international organization, but also with small businesses. I think it's when this is over that we're really going to see the impact of COVID. And I don't know when that will be over. At my company, it's until the end of the summer that we have kind of visibility in terms of who's furloughed, who's still full-time. And we'll see after then, it's really going to hit, I think, when this is stopped. So I would like to say that just like most countries, I don't know what the long-term impact will be, unfortunately.
Well, thank you both for sharing that. And one of the things I want to acknowledge is that this is, I was sharing with our alums on the call today, that this is our third conversation with alumni around the world talking about what the COVID experience has been like. And again, want to acknowledge and appreciate that what we're doing today is sharing perspectives. And apologize for putting you on the spot, understanding that we're not asking you to speak for your entire country, but do appreciate and acknowledge that it's the perspectives that are being shared, and appreciate you answering the curiosity of all the questions that are coming in from our very lively audience. So moving on to another one that, again, I think we would love for any one of us to have the answer to this. That said, excuse me. Here we go. What are your thoughts regarding potential vaccines? Will people in the United States and in Europe have the option to deny taking the future vaccines, or do you think it'll become mandatory for return to work and social? And again, if we had the answer to this, in reality, we might not be on this webinar with each other. We'd be out doing this work. But that said, appreciate your perspective in terms of what the conversations have been around vaccines in where you're at.
Can I just jump on? I know I just spoke, but I work across the street from the Gavi, which is the Vaccine Alliance. So my office is literally across the street from the World Health Campus. And one of my closest friends works for Gavi. She's American. She used to work for UCLA, actually, in finance, so from California. And she was telling, we talked a lot about this. And she was telling me that she sees that a lot of countries will make it mandatory, but resistance will vary per country. So it comes down again to how resilient people are and how challenging they are of their government. And I think we need to put everything into perspective. Like, Switzerland is a very small country with a different type of democracy. When the government says this is a measure, rules are followed. In the US, it would be a lot more complicated. I mean, I get sometimes a bit annoyed when people generalize the situation in the US. I think they need to understand it's a much larger country, different type of government, different levels. It's a lot more complex. So for Switzerland, I would say if there's a vaccine, no resistance. If it's mandatory, everyone will have it, get it, no problem. No challenge there. Everyone is just waiting for it. But as she told me as well, she said, I think there's going to be resistance in Europe as well. Matt, I'd be curious to hear what you think for the rest of Europe, and same for you, Francois, in France. But for Switzerland, no problem.
Okay. One other question that has come in, as I said, these questions are covering a range of topics this morning, is what are you hearing in terms of the ability of students, particularly from the United States, and the ability to study in your countries? Will they be allowed to do that? Anybody hearing about the status of that?
My understanding is that travel within the borders of the economic union is now strongly starting. I mean, it's not strongly starting, but it's becoming allowed again. It's going to be freely open within the borders of the EU countries. But talking about travel coming from outside of the EU countries, I think it's I believe it's going to continue being restricted on a need basis. So people traveling for business can ask for a right to entry, and students. I strongly believe that students will be able to enter as long as they are. They have an academic year to do in a European university, but I don't think it's going to be open for tourism this summer. I don't think so. My daughter is at Sciences Po, which is a very good institution in Paris. 2/3 of the students are from everywhere in the world, and probably half from outside of the EU. And students will be there on September 7th.
I think we are all watching what each other is doing in higher education in terms of determining, how can we have that on campus balance with virtual community. So certainly appreciate that. So Jade, I think this question is coming back to you, and we talked about this at the beginning of the call. So what are athletes and those in performing arts are taking any additional precautions versus the general public perhaps? And so any updates or thoughts around that?
Yes, so it really depends on the federation itself, the international federation or the organization, so professional or amateur. So basically, there's no blanket kind of regulation in place, and it also depends on the country where the event is hosted. So if we talk about Switzerland is supposed to host the Cycling World Championships in September, and I'm quite involved in that, so I keep a close eye on what's going on. And gatherings are allowed up to 1,000 people, and now they're saying that if it takes place, because it can change, from one day to another.
Does a gathering of 1,000 people, what's the allowances around social distancing?
1.5 meters. So whatever that means, I mean, I can already tell you it's not followed. When I said Swiss people follow rules, it's not when it comes to social distancing measures, not anymore. But yeah, for athletes, I think it just depends on where the event is hosted. They're saying that for everyone who's, well, the talk right now is that if you have an accreditation, so if you're an athlete, you're going to work for an event. Well, for this event, you're going to need to have done a COVID test, so to know if you've been negative or in the last few days. But I don't know if they have everything in place to do that. There's so many unknowns. Like, I don't understand why sports, I personally, not speaking on behalf of my company or Switzerland, think it's too soon for sports to start again, even though it's the industry I work in and I need sports to start again to keep my job. I think it's very soon, because you just need one person from one team to be infected and the whole league almost is jeopardized, because if the team has played against 2-3 other teams, then they all need to be on quarantine. So I think it's extremely soon for sports to start again.
That may be one of our next webinars, that topic alone. So a totally different question. Schools, K through 12, are schools opening up in your countries? I'm gonna throw that one to you, Matt. Where K through 12, are students back in school?
So surprisingly, actually, I don't have kids, so I'm not the best one to answer this question. But in short, I believe so, yes. And it actually was a phased approach, focusing on primary education first in Belgium, like a lot of different countries, I believe.
Schools open in France, Francois? K through 12?
Well, that was the big stake when deconfinement was decided middle May. is that kids can go back to schools. And there was an intent that it was important for kids, but behind that, the biggest intent was that parents could work again a bit more normally. So there was a big measure to enable some start again of the economy. So elementary and primary schools are reopened since mid-May, and they're fully reopened. But it's interesting to see that only half of the parents decided to put their kids back to school. Mm-hmm. And now we're very, very close to the end of the academic year, which is in 10 days now. Yeah. So and teachers are required to wear masks, which is something weird for kids, you know, that age. But kids are not required to. Kids till K-12 are not required to wear masks.
It is a challenge when you can't see that whole facial expression. So.
Absolutely.
So I have a yes or no question for you. We're running out of time almost. And someone wants to know, do you personally believe that there'll be a second wave in your country? Yes or no? A yes from Jade, I'm seeing.
100% yes. When? No idea.
Francois, do you believe it'll be a second wave in France?
Oh my goodness. That's first, of course, I have no idea on it, but it came as a strong. It struck me that you know, both answers were like yes, and I have no idea. I'm just so much hoping that no.
It's hard to juggle that with hope, isn't it?
Yeah.
Matt?
I'd have to say the odds are on yes.
Yeah. Well, as we said when we started, and again, as we're going through this, you know, again, really, really appreciate and value the fact that the three of you said yes to having this conversation with us and just sharing your perspective and your journey with our alumni, that now we can Zoom and be together from wherever we happen to be. And Jade, as you said earlier, in whatever time zone we happen to be in. So really appreciate your willingness to be with us today. Thanks to all of you for your presence and engaging in conversation and the good questions and the range of questions that we threw at our panelists today. So thank you for your openness to that. And my hope for each of you and for all of you on this call and the Zoom is that we stay healthy and we stay safe. And I have one of my favorite artists does a concert every day, one of the Tiny Desk Conference, and one of the ways that she always ends is to be mighty. So safe, strong, be mighty, and as always, go Bruins. So grateful for this community. Thank you very much.